Good afternoon. Earlier today, as you know, the World Health Organization officially declared COVID-19 as a pandemic. We have had, up to this point, 28 positive results in Florida. 26 of those have been Florida residents. 2 have been non-residents. 21 of the Florida residents have been diagnosed here in Florida. 21 have been diagnosed in Florida, but there have been 5 Florida residents diagnosed and isolated in other states. 2 non-Florida residents diagnosed and isolated in Florida, and we have had 2 patients pass away since this has started. A total amount of tests are 147 are currently pending results. 301 tests have come back negative. 877 people have been monitored for a 14-day period. 353 are currently being monitored. We had 8 new cases yesterday. 12 counties right now in Florida have a patient who is tested positive. It's important to know with those cases and many of the cases in Florida, we issued an advisory, our health department, on individuals who traveled to Egypt and took a cruise or a tour on the Nile River in February or March of 2020. The instructions were to self-isolate for 14 days following the return to the U.S. We've had several passengers, not just in Florida but in the U.S., have recently developed symptoms and have been confirmed to be infected with COVID-19, including, of all the positive cases in Florida, 10 of the positive cases have stemmed from this travel on the Nile River, and then 5 of the 8 new cases the Department of Health announced yesterday was connected to travel on the Nile. Was once we had the individual who passed away in Santa Rosa, his travel had been to the Nile River, and it was somewhat of an isolated case of travel. Then we had someone else test positive who had also been there, so our health department talked to CDC. CDC noticed there had been other cases. And so once it was figured out, hey, this probably was a problem, then the Florida Department of Health issued that guidance, and I think these positive cases were as a result of that alert going out. We do have the 4 individuals in Broward County. We've linked 3 of those to Port Everglades, and so there's a epidemiological investigation ongoing with those cases, and obviously we want to get as much information as possible. So we did declare a state of emergency on Monday. That's allowing Jared's working hard to procure different supplies, line up personnel if we need it. Allows us to bring in potentially people from out of state, which is good. Today we're announcing a further effort. I've directed Director Moskowitz as the state coordinating officer to temporarily prohibit visitation to nursing homes, assisted living facilities, adult family care homes, long-term care facilities, and adult group homes. And so these are the following individuals who are going to be temporarily prohibited from visiting these facilities. So any person infected with COVID-19 who has not had 2 consecutive negative test results separated by at least 24 hours, any person showing or presenting signs or symptoms of a respiratory infection, any person who has or may have been in close contact with a person infected with COVID-19 who has not tested negative is prohibited from visiting a facility for 14 days from their interaction with the infected individual. Any person who's traveled internationally is prohibited from visiting for 14 days subsequent to their return to the United States. Any person who traveled on a cruise ship is prohibited from visiting for 14 days from their return. Any person who's been in a community with confirmed community spread is prohibited from visiting for 14 days once they've exited that community that's been effective. And then any person who physically resides in a community with confirmed community spread. So these are important efforts to mitigate the risk to our most vulnerable population to COVID-19, which is our elderly population, and particularly those who have serious underlying medical conditions. As many of you know, this afternoon, the state university system announced our state universities would take proactive steps to mitigate the risks involved with our universities. And so you had Universities where students are coming back have been told, wait another 2 weeks, and then folks who are going to be on spring break are told to, to wait as well. So I think that those were prudent steps. I think because you have the ability to do distance learning, they'll be able to do that and not miss a huge beat, and they're going to continue to monitoring the situation and then make the best decisions that they can. And so I think that those were prudent steps. LabCorp and Quest, in terms of testing, have started testing individuals upon a doctor's orders, and the Florida Department of Health is identifying strategic CLIA-certified labs throughout the state to increase the state's testing capacity. So we're doing tests at 3 different state labs, Jacksonville, Tampa, and Miami. This would potentially, we actually have a lot of these labs throughout the states. The question is, we got to line them up, make sure they're able and willing to do it. And so that will add to the capacity in addition to the private sector. And then, I've spoken with some of the folks at the University of Florida. They're developing a test of their own, and this is something that will require the FDA to approve it, but they are working quickly, and the FDA is willing to work on a quick basis. And so that would potentially also enhance the testing capability. We're going to hear from Mary Mayhew, but she's been traveling the state, visiting these nursing homes. She's the Secretary of ACA. She tries to get in. They're taking her temperature. They're asking her the questions. So they have responded positively to the guidance, which we very much appreciate. In terms of the election on Tuesday, Jared is working with Secretary of State Laurel Lee, who's also working with the local supervisors of elections. I mean, the election's going to go on. There are, though, in certain counties, sites where people will actually vote in an assisted living facility. And if it's the residents in the assisted living facility, obviously that's fine, but you actually have some of these sites where the general public will come into the ALF. We obviously view that as problematic. Now, supervisors have the authority to make those changes as they see fit, but our recommendation would be that if there's a polling location assisted living facility, allow the residents to vote there, but maybe the general public should have the option or should be directed to go to a different polling location. And I think that there's ways to do that. And so Jared and Laura Lee are working with the local folks, but I think that that's a prudent step to take. So. And we're continuing in our efforts. We've been working with a lot of different folks throughout the state. I mean, you got a lot of people at the municipal level working very hard. Obviously, we have county health departments in all 67 counties. The private sector has been very responsive in working with us constructively on these issues. And then we've gotten great feedback and work with CDC and the folks on the coronavirus task force up in Washington. So we appreciate everyone that's been involved. And obviously, we're going to continue. We do not have, I spoke with Director Redfield and Dr. Fauci last night. Florida was identified as one of the 4 states, and it was said that there was, quote, community spread. We discussed, because that 3-person cluster in Broward can all be linked to the cruise ship, that technically doesn't qualify as community spread, which would be multiple people who we don't know where they got it from. And so we haven't necessarily gotten to that point yet, but we were cited as one of the states. We were number 4 for infections, but we were pretty far below the top 3, but they cited us for taking some of the mitigation steps that we're doing. And so we're working very hard to isolate the cases as they come in, contain the spread throughout Florida, but also taking steps to mitigate any potential damage if you end up having a situation where you do have verified community spread. And so with that, we're going to have this Surgeon General say a few words, Secretary Mayhew, and then Director Moskowitz. So.
Yeah, thank you, Governor. First, I really wish to emphasize that people continue to understand what COVID-19 is. This is a new virus that you can think of like the flu that can attack the lungs, and if it attacks the lungs of individuals who are elderly or have underlying medical conditions, they can be particularly affected. Increasing information is coming out showing that this is more severe than the flu, particularly for the elderly population, where the mortality rate can be 20 to 40 times more than with the flu. Again, because this is like a flu-like illness spread by coughing, the protective measures are what we'll continue to emphasize. Cover your cough. Stay at home when you're sick. Stay away from individuals who are ill, and continue to wash your hand. In terms of what our plan is at the state level, two major strategies: containment and mitigation. Containment means that if we identify an individual who has COVID-19, that we make sure that individual first has the health care that they need, and that their contacts are isolated. By having the isolated contacts, this way will stop community spread. As the governor mentioned, if we look at the individuals who have had COVID-19 in our state, with the exception of a few individuals, just about everybody, we can actually link their exposure back to either international travel, a cruise, or contact with somebody who has COVID-19. As the governor mentioned, we are not seeing community spread, but this is something that we are watching very, very carefully. Again, I really wish to emphasize the importance of public health measures, which are found on our Department of Health website. Again, cover your cough, stay at home when you're sick, frequent hand washing, and staying away from individuals who are ill. Thank you.
Mary?
Thank you. As the governor mentioned, I have been traveling our state this week to assess the needs of healthcare providers across Florida and to hear the challenges they are confronting on the front lines. Facilities across Florida are taking every precaution to ensure the health and safety of patients and residents and protect the welfare of their healthcare staff. We know the most effective way to protect Florida's most vulnerable residents is to prevent the infection or those with symptoms of an infection from entering the facility. The first line of defense is vigilant screening of visitors, vendors, and staff. As the governor mentioned, as I have been out in facilities, I have had my temperature taken, I have answered all of the questions, and I have been prepared to be comprehensively screened. No one is exempt from the screening. Every provider I have visited has been unequivocal in their support for and implementation of these screening protocols. And every facility must have the necessary tools at their disposal to keep patients and residents safe. That's why this executive order is so critical. I want to thank Governor DeSantis, Surgeon General Rifkes, and Director Moskowitz for their leadership while the state faces this public health emergency. Today's executive order will help ensure facilities can take necessary measures to protect Florida's most vulnerable populations. We've seen the tragic situation in Washington State and a nursing home there. The choice is clear. Florida will and must take every step to prevent real and potentially fatal threats to our elderly and senior populations and those with underlying health conditions. This executive order is formalizing many of the precautions we have already asked nursing homes, assisted living facilities, and other residential providers to take. Healthcare providers across Florida have the full support of this administration to put up a strong line of defense against COVID-19 in our communities. Beyond this executive order, my agency has had a laser beam focus on those who are most at risk for infections. And we remain in constant communication with Florida's skilled nursing and assisted living facilities and their statewide associations. My agency has a clear and determined focus on ensuring the safety and welfare of hospital, nursing home, and assisted living facility patients and protecting the healthcare workforce caring for them. Healthcare providers are executing their infection control procedures, which they are required to maintain at all times. Hospitals and nursing homes plan, train, and drill on infection prevention and control precautions. These protocols are ingrained in their standard operating procedures. Additionally, my agency has taken decisive action to visit all hospitals, nursing homes, and assisted living facilities that have had issues related to infection control and prevention. Any deficiencies that we have identified in the last year, we are prioritizing on-site inspections and visits. These visits will allow my agency to focus our efforts on addressing the spread of COVID-19 and to ensure adherence to the infection prevention and control protocols that we expect. Again, I want to thank Governor DeSantis for his strong support in protecting Florida's nursing homes, assisted living facilities, and other residential providers. Thank you.
Thank you. Governor, thank you for your leadership in our response to COVID-19. Thank you for taking these proactive, preventative measures. As you know, the governor declared a state of emergency, which helped set up a unified command structure between the Division of Emergency Management, the Department of Health, and all state agencies. At the Division of Emergency Management, we have been working for the last several weeks on planning on multiple contingencies, and we are now starting to get resources, the necessary resources that we need to go and act those plans. We are following the comprehensive emergency plan here in the state of Florida. Year after year, we train for all sorts of different situations like pandemics. And so we are following that plan. My folks are working around the clock at a level 2 at the Emergency Operations Center. I want to thank all the state agency heads that are here today and that are working on this issue in a collaborative, unified effort. And so everyone at the division will continue to try to be ready for every contingency and have the necessary resources. And I just want to thank the governor again for taking these proactive preventative measures. Thank you.
Great. Mike?
Yes, Governor, given the late hour last night when the most recent cases were announced, what's your policy about timely release of this information?
Yeah, get it out quick. So we found out late. I think my phone was blowing up. Very, very late at night. My kids were sleeping. My wife is sleeping. We're getting to the end of the road on her pregnancy, and so we're hopefully I try to give want to give her as much peace and quiet as we can. But yeah, I said, get it out as quickly as you can. Now, obviously, you don't want to be reckless. You want it to be reliable. But I think just getting out as quickly as possible upon us receiving the information at the Department of Health is the way to go. And I think that they've done a good job of being timely and really getting on a more assertive footing with that. You know, when you're dealing with people in the medical, because HIPAA and all this, they're just not used to kind of doing that. But once the public health emergency was declared, I know the Surgeon General and I really believe that we want to get that information out. So it wasn't because we knew in the morning and put it out. It was because we got all this information, later in the evening, but didn't want to let it sit. Wanted to get out there for the folks.
As close as possible to real time.
Oh yeah. No, absolutely, for sure. Yes.
Governor, there's been a lot of confusion about a lot of the terms surrounding this pandemic. One of them is travel related, whether a case has been travel related or not. We've received reports of someone who has a confirmed case whose case was classified as travel related, but they themselves did not travel internationally. So what does that term mean, and is that at all an indication of community spread?
So it's I'm not exactly sure. I'd have to get the facts on the individual. But I think if you have been exposed to somebody who had been traveling from those areas, then it would not be considered community spread because we'd be able to identify the source and trace it back to those areas. With a community spread situation, you have 3 or 4 people never traveled, wasn't in contact with anyone that traveled, then that's when you start thinking, hey, well, maybe they, touched the public railing and then started doing all this. And so that's kind of, so if you can't link the cases, that's when they're doing it. All the cases except one so far have had a link to either someone who's been positive or has been traveling in that area or who themselves had traveled. They're the one, so we've had 4 in Broward. There is the one they're still doing the investigation on. But then there was also another individual who initially had not traveled, but then they were able to determine contacts with people who had been traveling.
Governor, just some clarification. All international travelers on your order, or not just people from specific countries?
For the nursing homes, that's correct.
Okay, so all international
Right.
travel. Number 2, all state university systems are going to be not coming back? Or
Well, it's just 2 weeks. So, the folks who are coming back from spring break, we're told to take 2 weeks, and this is real-time dynamic situation. They're going to constantly reassess, but all the instructors have been told get on a virtual footing. And maybe that means a couple weeks, and who knows, maybe it looks better. But I think we're preparing to see more cases, just because I think that's the prudent thing to do. So I think that's prudent for them to do it, and then they can reassess in real time as we go. But at the end of the day, particularly for some of the universities, if you're taking a lecture course or something, honestly, you can do it online and probably be okay. So I think it's actually pretty minimally disruptive to kind of the way the state operates.
Governor, you just said that the administration, healthcare providers have the full support, your administration fully supports them, and that you're anticipating, them to treat patients. Yet.
So Secretary Mayhew said that, right?
Sorry.
Okay,
Part
yeah.
of your
Good. I mean, we want to support, but.
But that comes at a time when your administration Medicaid officials are recommending a $25 million cut to hospitals. I'm wondering how to reconcile that.
You want to?
I do. We are not recommending a cut. That has been a consistent mischaracterization. We, in fact, have supported hospitals receiving additional funding. The governor was very supportive, especially as hospitals are incurring these additional expenditures in this crisis. So not only did we come in, acknowledge a mistake, see that that was fixed, we actually advocated for the additional $25 million. There has not been a cut recommended by this administration.
So when you advocated it, does that mean the legislature did not appropriate it? If you advocated it, is it the legislature that's not properly funding it?
I understand that things are still fluid, so I'd hate to comment on where things stand today. What I know is that we came in and supported those additional dollars.
Thank you.
You're very welcome.
Going back to community spread, Governor, I wanted to ask how we can say right now that there is no community spread when we're not testing as widely as some other states are.
Well, first of all, we're testing consistent with the CDC guidelines, and so that's why. And so, I can't say yes or no based on I don't have knowledge of everything, all 21 million people. But as cases come in, they're tested. If there's a positive, then the investigation goes on. And so, but in Florida, if you meet the criteria, and not just if you've traveled or been in contact with someone that's traveled, if you're hospitalized with respiratory infections, or if a doctor recommends, particularly for those who are more elderly, then you can do it. At the same time, we're working with Jared. That's one of the reasons I reached out to University of Florida, because I think it would be good to be doing some diagnostic and to try to figure out, okay, as people are just coming in for routine doctor's visits, we'll do that with the flu. Take a swab, try to figure out what's the flu situation with our children when they come in for pediatric care, and that's all done. So I think I've urged the Surgeon General, figure out how we can do that in Florida, because, and I've said many times, you have a situation where this could be life-threatening for people, primarily who are elderly or have health conditions, but for younger people, the symptoms are very modest. And so the issue is if somebody just has a little bit of a cough or a very mild fever, they probably aren't going to rush into the doctor's office normally. Now, maybe as this thing has gotten bigger and more prevalent, maybe people start changing their behavior. But we're definitely concerned about who may be carrying it, who doesn't seem like an obvious case to be carrying it. And that's one of the issues that we've talked about with the schools. If you look at the K through 12, I mean, the data is overwhelming that there's not very much negative impact that's happened thus far on young children. But we don't know how efficient carriers they are of that. Obviously, we have children here who have grandparents here. How do you visit? What would be the risk there? So I'm definitely in favor of doing more of that, and we're working on ways to be able to do it. But at the end of the day, once cases present themselves, everyone that's presented themselves have been tested. We've gotten the results. They've done the investigation. They've not been able to identify community spread. At the same time, this is a dynamic situation. We have 125 million people come to visit our state, and so we're prepared to respond as the facts change.
So it's not a lack of data, the fact that you really don't know if there's community spread, and doesn't that sort of emphasize the need to increase the amount of testing? And how much testing can you do now, and how much do you think you'll be able to do with lab costs?
Well, as you know, there was initially the tests from the CDC were done in a way that would have led to a lot of false positives. And so that is now being rectified. They're going to have, within short order, 4 million tests. They've said that multiple times. Florida's share of that would obviously be I think, hopefully significant. And then we've had capacity to meet everyone that's been coming in now. And so that's been consistent. We would like to, we could increase the amount of tests per day at each lab if the circumstances warranted it. But the fact of looking at these other CLIA certified labs would allow us to potentially expand there. And then, of course, having Quest and LabCorp, with the private sector, they would then be there. And then our universities, if they're developing tests, that's what Washington ultimately did. They had the university develop a test, and FDA turned it around pretty quickly, gave approval, and then so you started to see that as an outlet. So we definitely want to do it. But we've not had anybody who's come in from any of these countries, who's been in contact with any of these people, showing the symptoms, who's not been given the test. And so, and I think we obviously want to keep that going. But I'm definitely in favor of having some type of diagnostic, but you got to figure out the best way to do it. What they are doing now, though, at the Department of Health is they look at the data from all the different emergency rooms, hospitals. I think a lot of the doctor's office participate, and they look to see changes in things that are going on. And the Surgeon General has looked at it, his staff has looked at it. There's not been any spike in flu-like symptoms, travel-related illnesses, or anything anywhere in the state over the past 2 months. And so that's not a perfect tool. That is one indicator that they're using, but I think it would be good to be able to have more.
Two more questions.
Since this news conference started, the NCAA has actually said they're going to limit fans of the men's and women's basketball tournaments. I'm wondering what conversations you've had, either with, the Disney, Universal, spring training, those type of events that also bring large amounts of people to Florida.
Yeah, so I spoke with President Thrasher at FSU. Obviously, they've got a lot of competitions. I think they have a baseball game tonight. They're going forward with that. And I think there is, gatherings are generally issues you deal with. Some of the indoor ones may present more risk depending on how that is than some of the outdoor ones. So I think they got to be taken on on a case-by-case basis. But I know that our universities are looking at that for sure. And then, the Department of Health has been in contact with the theme parks, and they're doing a lot, though. When you like the people using the restrooms there, I don't think you've ever seen so much cleaning agents being applied. They are really working hard to keep those theme parks in good working order.
Governor, are there any plans from the administration to actually limit visitations in the prison system, given that there are elderly inmates, such as the limitations with nursing homes?
Yeah, so the Corrections Secretary, Inch, is going to either put, I've approved him to take that type of action. I don't know if he's put it out yet, but if not, that's coming. Yeah, so there will be revised guidance for the prison. So.
Are they going to be similar to the nursing homes?
I don't know if it'll be exactly the same. I think the nursing homes, we're taking really significant mitigation steps just given the threat. Obviously, prisons is also a threat, but it's a little bit different. So, but I think that they're common sense measures that he wants to do. I didn't see any problem with it, and I think that's the way to go. So, okay, well, we'll have more updates as things happen. So, thank you very much.